Okay. That's all. It's only one time, folks, so I don't see a whole bunch of hands, okay?
I'm just wondering if you could explain your education background and
Sure.
how you made the choices like to go on for your MBA.
My education background kind of is taking a very strange course. Believe it or not, my first degree is oceanography. That's how I got here. My wife, Jan, who's here with me this evening, was a nurse. And I got interested in the whole healthcare arena. I kind of moved into hospitals, hospital care. And after I finished my undergraduate degree, I realized that I enjoyed managing groups of people. And unfortunately in life, skill set is not enough. Something's got to punch the ticket. And you need kind of, if I wanted to run things, people want to get MBAs or Master of Hospital Administration, so I'm back to get it. Which was, don't get me wrong, it was a very valuable experience. I'm glad I did that. And so I went from, leading hospital organizations to leading other types of organizations, and today I lead one of the nation's largest healthcare companies in the U.S., also in the world. And it was through, frankly, a combination of where my interests were and my desire to pursue those interests. Don't ever downplay passion. Passion is as important as intelligence, trust me. And if you're passionate, you really want to do something, you want to pursue a course, don't let anything or anyone tell you you can't do it. You will be able to do it. And so how I got here was through my passion. I enjoy leading. I enjoy creating environments where folks can exercise their gifts and skills. And I'm okay at it. I'm okay at doing that. Yes, sir.
What are some of your thoughts on the national healthcare debate, particularly about the idea of controlling costs through capping services and the growth in services with Medicaid, Medicare populations?
You ever hear a question? The question really had to do with what are my thoughts about healthcare reform potentially capping healthcare services. I'm going to now let out some of my biases, and either you accept those or not accept those. I am a believer that you can never take away choice from me. I want to be able to, anytime I want to choose my doctor. I also want to be able to choose, in concert with my healthcare professionals, my care plan. That being said, I might have to pay a little bit more in order to have that done. I think that the dialogue, the discussion that is going on today is driven by cost. Access is not really a problem, and tonight I'm going to talk about, I don't think we have time to talk about access today. It's cost. But the cost is a function of a dysfunctional system. And by dysfunction, I mean, let's go back to these silos of care. Healthcare today, and I'm a recipient of that, my company, is rewarded for activity. It's not rewarded for outcome. So in other words, we're volume driven. The more we do, the more money we make. We all know that, we're Americans, right? The more we do, the more we make. We have to migrate to a value-driven environment. And if you don't think that's going to happen, guess what happened in Detroit, folks? It was all about volume. Put out the cars, put out the cars, put out the cars, put out the cars. Now it's about value. People want to buy value. Healthcare is at value today. What I think about potential rationing of care, it's about time. It's about time. Now, rationing has many connotations to it. By rationing, I mean, if I'm 95 years old and I want to have a hip replacement, don't pay for it out of my pocket. Because the reality is, my life expectancy probably is 6 months at 95, if I'm going to have hip replacement. So if you look at the discussion that is going on in Washington right now, in Senator Box's bill, there is a provision in the bill that talks about giving an agency overseeing Medicare the authority, in the event costs run skyrocketing, to, number one, decrease reimbursement to providers, and number two, decrease access to recipients. It's in the bill. It's in the bill. Now, what that is rationing of healthcare. that is rationing of healthcare. I think it's okay. I think it's okay. Now, again, you may disagree with me, but we have to do something when we're spending 17% of our gross domestic product. Even more scarier is the fact that a recent study just out last week said that this rate, 120% of the value we create in terms of growth in this country is going to go to healthcare. Can't do it. Just can't do it. Now, let's talk about some solution now, because I think solution is what we need to focus on. And I'm not an architect, but architects are taught day one in architectural school. Form follows function. In other words, the form of what you take to solve a building solution is you first have to understand the function of what the building's for. And that is drilled into their head. And I think this problem with healthcare is form follows function. Functionally, what's wrong is that we have a system that is broke. We have at the pinnacle of healthcare this godlike figure called a physician. And all due respect to physicians in this room, if there are any, I understand you worked hard, I understand you did a lot of schooling, I understand you're very intelligent. I don't take that away from you. However, you've been burdened with a responsibility that's far beyond your capability. I employ about 8,000 physicians. Of those, about half of them work in emergency departments that I manage for hospitals. Half the patients we see by a physician does not require a physician. Now let's just take that all the way down to what really happens. What happens? I charge Medicare, I charge your insurance, I charge Medicaid for seeing that physician. And I'll be honest with you, I would rather, if I go into ER and I have a minor problem, I'd rather see a nurse practitioner or a PA, and my cost is half the cost. So that's half the problem right there. The bottle's broken. Yes, sir.
Follow up on that point then. Western is floating this idea of a med
I'm sorry?
Follow up on that line that you're discussing. Western's considered a med school right now. What's your opinion on having a med school here versus expanding the allied health fields and get more PAs, nurse practitioners, social workers, and all those things?
Your statement leads me to believe you think they're mutually exclusive. I don't think they are. I think having a med school on this campus in conjunction with the School of Health and Human Services is phenomenal. Because healthcare is heading towards a team concept of care. And physicians will be fundamental to that care. And you have a laboratory potentially being percolated here, whereby